this month we were thinking about how to use quality improvement tools to improve our consultations with our child patients, particularly around feverish children and common childhood infections. Recently, we had a tragic incident in that one of our very young patients, a 5-month-old, died. Sadly, the baby was taken to casualty and was pronounced dead on arrival. This is obviously quite rare but very sad case for us, and it got me just thinking about how we consult with our child patients as they can get better but also ill very quickly. And I wondered if the 4 of us as GPs in the practice were all asking the same questions and whether we were safety netting enough and explaining to parents when they needed to worry, as common colds are very common and happen frequently, but many cases of sepsis and meningitis sadly do occur, leading to death. So when I was on the General Practice Improvement Leaders Programme, I learned a really good tool called process mapping. Process mapping is a visual representation of steps in a defined process. This visual representation can show us whether there's gaps in a process or duplication or lack of consistency as well, and that can be really useful to give us a real-time analysis of what's really going on. We made a few tweaks to our process and it was very easy to see on the visual map, and so as there was an inconsistency between the patients coming in for a face-to-face exam, we decided that one of the tweaks we would make is that the doctors would record explicitly in the records if there was a parental concern and be clear that that's the reason why the child was being invited in for an examination. The other, I think, really helpful tweak also was the age-old concern over whether to prescribe antibiotics or whether not to prescribe antibiotics. And as antibiotic resistance increases in the community, this is really, really important. And we were not using the NICE guidelines, and it was really easy to see from the visual representation the inconsistency. So now we have all agreed to use the NICE guidelines. One of the other things that came out of the process mapping exercise was to be able to develop a standardized computer template with all the ideas and the consistent ideas that we had all shared during our process mapping exercise. This process, I think, will be hugely beneficial for parents and patients because it is often very frightening to have a sick child and not be quite sure what to do. And this process has ensured that we can give consistent and very clear, detailed advice to parents about safety netting. The process mapping exercise has had many benefits for the practice team. I was delighted to be able to share my knowledge of process mapping with the other GPs and staff in the practice so that now they've learnt a quality improvement tool. It's also brought some fun and activity into practice meetings. There was lots of lively laughter and idea sharing. And of course, it's really helped the GPs medico-legally and clinically in that now their records will be consistent and standardised. And if we want to have other healthcare professionals such as advanced nurse practitioners or pharmacists working with us in future, we have a standard template that they can use in case they forget to ask a question. It's all there for them with links to the updated guidance.